People often ask the question, what's the rate of success with IVF treatment or fertility treatment in general? Well, first of all, we need to know that it's never 100%, because people who are perfectly normal, trying to get pregnant in the natural way, will not be 100% successful every month. But with repeated attempts, they will get pregnant, God's willing. Now, the two main factors that decide the chance of success with IVF or other fertility treatments are very clear and have been proven the world over with scientific studies. The first thing, which is very important, is the age of the woman. As we all know, the younger the lady is, the higher the chances of success. So if you want to try for a pregnancy and you're thinking, should you do it now or should you postpone it for a few years later when you've probably done other things in life, then the best piece of advice I can give you is try as early as possible. Of course, other things come in the way, but all things being equal, the younger the woman is, the higher the chance of success. The second important factor is something within your hand, which is what clinic you go to for treatment. Again, scientific studies have shown that the more experienced clinic, the more advanced clinic, will have higher chance of success in the same couple compared with other clinics. You cannot control your age, but you can decide which clinic you go to. So before you decide which clinic to go to, do your homework, check on the internet, speak to other people who've been treated, and check where you're more likely to get successful treatment. Check also the CV of the doctors you're going to go to. All these things are available on the net now. It's a wonderful resources out there. So before you go and get your treatment, do some window shopping, as we say, because your health is very important. Your chance of success are very valuable to you, so please think of them wisely and choose where to go. And I wish you all the best. Another common question we usually get is, who's at fault? Is it the man's fault or the woman's fault or both of them? First of all, I would like to debunk this myth. It's no one's fault. It's just, it takes two to tango. You cannot clap with one hand, and we need both the man and the woman for things to go right. And when things don't work, we do check both sides, but that's to help, not to allocate faults. But generally speaking, about 1/3 of the cases are due to issues with the man. 1/3 of the cases are due to issues with the woman. About 20% of the cases, there is both contribution from the man and the woman. And that's why it's very important, even if there is an obvious problem in the man or an obvious problem in the lady, we should check both of them. And about 10% of cases is what we call unexplained. That means a reason has not been found despite all the tests we've done. But the good news is, regardless whatever the cause may be, there are treatments. This science has advanced tremendously over the tens of years till now, and we know what to do in most cases, and most cases with the appropriate science, appropriate treatment, and repeated attempts, we will get there and help you have the baby you want. Thank you.